The death of actor Luke Perry is shining a light now on a major health issue among men. That's the increasing number of strokes suffered by men in their 30s, 40s, and 50s. Experts say it's important to know the risk factors and the warning signs of a stroke. And for more on that, we're joined now by Dr. David Tong, Regional Director of Stroke Programs with Sutter Health. Dr. Tong, good of you to be here today. A very important issue that should be discussed. First of all, let me ask you about the situation with Luke Perry, the death of Luke Perry. A lot of people were surprised by that, given his age. But I know that, and you're going to tell us that stroke can affect people of any age.
That's right. It can affect all ages, all ethnicities, both male and female. It is true that strokes tend to not occur as often in the younger age group, but up to 15% of patients below the age of 55 will have a stroke, so it's definitely not unheard of.
All right, so let's talk about the risk factors here and who is most at risk.
Right.
Talk about men. Yeah.
Yeah, so, you know, a lot of the risk factors are things that are very well known to most people, things like high blood pressure, diabetes, hypertension, high cholesterol, certain heart conditions. Those are the things that we really worry about in terms of risk factors. Smoking is another one that's very common. So these are the things that I think most people are aware of, similar to other cardiovascular disease.
Are there certain age groups, any certain groups that should be really keyed in on looking out for those risk factors? Yeah,
if you have any of those risk factors that I already described, or you have a heart condition, generally speaking, as people get older, their risk of stroke increases over time. So those things are the things that we really look for when we're trying to evaluate a patient for stroke.
All right. So what are the lifestyle changes that you recommend to patients if they have any of those risk factors?
Well, obviously, you want to have a normal weight. You want to exercise on a regular basis. You want to avoid risk factors such as smoking or excessive alcohol use. You want to make sure that your blood pressure is well controlled, that you're not having a high-fat diet or something where there's a lot of excess calories in it, those kind of things.
Let's talk a little bit about the warning signs, what people should be looking out for, you know, the signs that maybe someone that they love is suffering from a stroke. We always hear about the acronym FAST, right. F-A-S-T. Right. What does that stand for?
FAST stands for face, arm, speech, and time. So face, facial weakness or numbness, speech difficulties, slurred speech, incoherent speech, having trouble with talking, having trouble with being able to describe things, just like what I'm having right now, or I'm having a little trouble talking right this moment. Those are the kind of things that we look for. And of course, time is of the essence, that you really have to be very quick in getting it treated.
Speaking of you know, getting someone help as quickly as possible if you think they may be suffering a stroke, I know that Sutter Health, you have a mobile stroke unit. How does that work?
Yeah, so this is really very exciting technology. One of the things that we've realized when we're taking care of stroke patients is that we really have to treat them as quickly as possible after the time of onset. So what's the fastest way that you can get to a patient? Well, the fastest way is to actually go to their house, to go into their actual living area and treat the patient right there. So what a mobile stroke unit is really a mini hospital. It's a hospital on wheels. And what we do is we drive the mobile stroke unit to the patient. We put them within the ambulance, and in the ambulance they get a CAT scan done right in the ambulance. There's a CAT scan inside the ambulance. There's a pharmacy in the ambulance, so you can give the treatment right away. There's either a live doctor, or more recently we use telemedicine, where we actually have a remote access like Skype within the ambulance, and we're able to evaluate the patient in real time, and we can really rapidly treat the patient in that way.
Yeah, you can treat them much more quickly. All right, Dr. David Tong with Sutter Health. Really appreciate you coming in. Really good information.
Thank you.
Thank you.